Introduction. Welcome, esteemed medical students, to today's lecture on the intricate topic of cardiac amyloidosis. As future cardiologists, it is crucial for you to understand the complex nature of this condition in order to provide accurate diagnosis and effective treatment to patients. Throughout this comprehensive lecture, we will delve into various aspects of cardiac amyloidosis, ranging from its anatomical underpinnings to advanced therapeutic interventions. So, without further ado, let us embark on this journey of knowledge. To grasp the disruptive nature of cardiac amyloidosis, we must first establish a solid foundation of the heart's normal structure and function. The heart, a vital organ comprising 4 chambers, each with its own unique anatomical characteristics, works tirelessly to maintain systemic circulation. Understanding the intricate interplay between the ventricles, atria, valves, and blood vessels will elucidate how cardiac amyloidosis disrupts the finely tuned physiology. The process of protein misfolding and subsequent aggregation is a pivotal factor in the pathogenesis of numerous diseases, including cardiac amyloidosis. Proteins, the building blocks of life, must fold into specific three-dimensional structures to function properly. However, when misfolded, they can accumulate as toxic aggregates. In this topic, we will delve into the mechanisms driving protein misfolding, the role of chaperones in preventing aggregation, and the consequences of misfolded proteins in various diseases, with a specialized focus on their implications in cardiac amyloidosis. Now, let us journey into the molecular realm and explore the mechanisms and triggers that give rise to the formation of amyloid fibrils in cardiac amyloidosis. Abnormal protein folding, proteotoxicity, and genetic mutations play pivotal roles in initiating the cascade of events leading to fibril formation. By gaining a comprehensive understanding of the molecular pathways and factors underlying amyloid fibril formation, we can pave the way for targeted therapeutic interventions. Among the various types of cardiac amyloidosis, immunoglobulin light chain, AL, amyloidosis accounts for the majority of cases. In this topic, we will extensively analyze the pathophysiology, clinical manifestations, diagnostic approaches, and treatment options specific to AL amyloidosis. By exploring these aspects, you will gain valuable insights into the complexities of managing this subtype of cardiac amyloidosis. Another significant form of cardiac amyloidosis is transthyretin, ATTR, amyloidosis, which can be further categorized into genetic and non-genetic variants. This topic will delve into the genetic and molecular basis of ATTR amyloidosis, the patterns of cardiac involvement, and the specialized considerations when diagnosing and treating this form of cardiac amyloidosis. By the end of this topic, you will be well equipped to navigate the intricacies associated with ATTR amyloidosis. Advanced nuclear imaging techniques offer valuable insights into the presence and distribution of cardiac amyloid deposits. Scintigraphy with technetium-labeled bone-seeking tracers or radiopharmaceuticals specifically targeting cardiac amyloid deposits can aid in accurate diagnosis and monitoring of the disease. Here, we will discuss the principles underlying these imaging techniques, their clinical applications, and their role in the management of cardiac amyloidosis. In addition to nuclear imaging techniques, cardiac magnetic resonance imaging, MRI, has emerged as a powerful diagnostic tool in the evaluation of cardiac amyloidosis. This topic will elucidate the utility of cardiac MRI in identifying structural abnormalities, assessing myocardial tissue characteristics, and detecting extracardiac involvement in patients with cardiac amyloidosis. Gain a thorough understanding of the interpretation and clinical applications of cardiac MRI in this comprehensive discussion. When it comes to definitively diagnosing cardiac amyloidosis, endomyocardial biopsy plays a crucial role. Through this topic, we will explore the indications, techniques, limitations, and interpretation of endomyocardial biopsies in the context of cardiac amyloidosis. Emphasis will be placed on specific staining techniques and immunohistochemistry to enhance the diagnostic accuracy and inform treatment decisions. As future cardiologists, it is essential to be familiar with the evidence-based treatment options for patients with cardiac amyloidosis. This topic will analyze the various pharmacological therapies available, including disease-modifying agents aimed at addressing the underlying pathophysiology, supportive measures for managing heart failure, and newer agents targeting amyloid fibril formation or deposition. By understanding the nuances of pharmacotherapy, you will be better equipped to provide optimal care to patients. In recent years, stem cell transplantation and gene therapy have garnered attention as potential therapeutic interventions for cardiac amyloidosis. In this topic, we will examine the underlying principles, experimental evidence, and future prospects of these emerging treatment modalities. By delving into the potential of stem cell and gene therapies, you will gain insight into the forefront of medical research in cardiac amyloidosis. Cardiac amyloidosis often manifests with electrophysiological abnormalities, including conduction disturbances and atrial arrhythmias. This topic will investigate these rhythm abnormalities in detail, discussing their pathophysiological mechanisms, clinical implications, and the need for specialized rhythm monitoring and intervention strategies. Mastery of this topic will enable you to identify and manage rhythm disturbances effectively in patients with cardiac amyloidosis. The management of heart failure in patients with cardiac amyloidosis poses unique challenges. This final topic will shed light on the complexities associated with advanced heart failure in the context of cardiac amyloidosis. Special considerations for device therapy, transplantation, and palliative care in advanced stages of the disease will be explored, equipping you with the knowledge to provide comprehensive and compassionate care to patients in need. In conclusion, we have covered the complex topic of cardiac amyloidosis, focusing on the heart's functioning, diagnosis, and treatments. This knowledge will be valuable in your future as cardiologists, enabling you to contribute to the care of patients with this condition.